Introduction. Good hygiene is an important barrier to many infectious diseases, including the physical oral diseases, and promote comfort, safety, and better health. Personal hygiene is the basic concept of cleaning, grooming, and it is the first step to good health. Besides that, it is considered as one of the most important part of our daily lives at home and at workplace, which help us to protect ourselves and keep us with good health. As a whole, personal hygiene is the care of our bodies. Personal hygiene includes different habits, that is, washing hands and brushing teeth, which keep bacteria, viruses, and fungal far away from our bodies. Moreover, these habits will help us to protect our mental health and activity. Also, good personal hygiene will help us to keep feeling good about ourselves, since those who do not take care of their personal hygiene, that is, dirty clothes, body odor, and bad breath, will suffer from discrimination, and this will mainly lead to mental problems. But the most important point is that all people have their own hygiene, but some people do it better than others. This will mainly depend on each person, culture, society, and family norms. Now we have skin care. Skin is the largest organ of the body. Skin is the body's first line of defense against disease. Intact skin prevents microbes from entering the body and causing an infection. It is the largest system. It is the body's natural covering. There are two layers. Number A, the epidermis, which is the outer layer. Then number B, the dermis, which is the inner layer. Skin plays an important role in maintaining body temperature by continuous sweat evaporation. Skin gives information like pain, heat, and cold after perception of touch. Hence, care must be taken for its proper maintenance. Likewise, regular cleaning of skin is desirable as it removes sebum, sweat, dead skin, dirt, cosmetics, and some bacteria. Number 2, regular bathing will soap and cold water during hot humid climate is essential, but in winter days, more bathing causes itching and dryness of the skin. So, bathing with slight warm water is preferred. Number 3, usually at puberty boys and girls suffer from acne, problems which bring disfigurement in their appearance. Acne can be improved by enough sleeping, exercise, avoiding irritant and food like chocolate, nuts, seafood, fried food, sweet and spicy foods. Number 4, improper care of the skin leads to bacterial infections and cause boils and warts. Boil and warts can be removed by freezing or by electric sparks or the old method of rubbing them with horsetails. Number 5, loss of pigmentation of the skin result in white patches of a forehead, cheek, chin, or any part of the body. Number 6, the skin is attacked by fungal infections. The mark of the infections are ring-shaped, hence it is called ringworm. It affects the site of the groin, scalp, foot, nails. It spreads rapidly from one person to another. Number 7, among all skin diseases, scabies is most prominent. It can be treated by the application of the medicinal ointment. Number 8, another condition of the skin is eczema. The area is itchy or non-itchy. there is inflammation of the skin. So, to get rid of it, we should keep the skin well hydrated and away from woolen and synthetic, as sweating makes it worse. It is better to stay in a cool environment. Anti-allergic medicines and steroid ointment can be effective. Number 9. Leprosy is a contagious disease which appears as a patches on the skin. It is caused by a bacteria. The patch is either paler than normal skin color or reddish. Margins of the patch are generally well demarcated from the surrounding skin. There may be ulcer in foot and nose. These cases are infective and are to be isolated. Moles and tumors may be present on the skin. Moles are harmless and rarely become cancerous. Therefore, any moles which appears later in the body or one which changes in size rapidly tending to bleed needs to be shown to the skin specialist. Likewise, tumors are overgrowths which rapidly appear on the skin. To keep the skin in proper order, regular washing of hands and the face before eating and after using the lavatory is necessary. Cold baths like swimming and sea bathing are taken for their tonic effects. Use of special creams having a protective function to protect the hands or chemical substances is advisable. Now we have mouth care. The condition of the various parts of our mouth, that is, the tongue, the teeth, the gum, reveals much about the health habits. Halitosis or offensive mouth odor is indicative of poor oral hygiene. This foul smell is primarily a result of cell decay and the odor of characteristics of growth of some microorganisms. Halitosis can also result from infected or diseased gums, decaying teeth, or oral tumors. An attractive smile is often the first thing one notices about others. In addition to creating an attractive appearance, healthy teeth and gums are a basic requirement for overall good health. For good oral sanitation, one should brush one's teeth every morning and before going to sleep at night. Brushing teeth in the morning is a ritual with most of us, but not brushing before going to bed, which is also very important because hopefully mouth remains shut with we sleep that is for approximately 7 to 8 hours. This causes decay of whatever is stuck to teeth or to the gums and allows bacteria to grow during sleep, causing decomposition as well as foul smell. Mouth care or so-called oral hygiene does the following. Number 1, keep the mouth and teeth clean. Number 2, prevent mouth odors and infections. Number 3, increases comfort. Number 4, makes food taste better. Number 5, reduces the risk for cavities and periodontal disease. Plaque and tartar bleed up from poor oral hygiene. Plaque is a thin film that sticks on teeth. It contains saliva, microbes, and other substances. Plaque causes tooth decay. Hardened plaque is called tartar. Tartar builds up at the gum line near the neck of the tooth. Tartar buildup causes periodontal disease. The gums are red and swollen and bleed easily. As the disease progresses, bone is destroyed and teeth is loosened. So, tooth loss is also very common. After this, we have nails care. Nails are extension of the epidermis or outer layer of the skin. What we see of the nails is really a dead tissue called keratin, but it originates in cells that are very much alive. One can feel the pain in this live part of the nails if the nail breaks close to its roots. Nails should be kept short so that nothing accumulates under them. One should make a special effort to clean under nails while washing hands. Some of the problems associated with nails are result of too much manicuring. To ensure healthy and kill those nails, feet should be soaked in warm water once a day and nail cleaned with brush and soft water. Infection or injury of the tissue at the base of the fingernails may cause its surface to become rigid or to split. Inflammation of the finger joints in case of arthritis can also result in nail deformities. Brittleness of the nail can be caused by chemical in polish removers, soaps and detergents. It is also a natural consequence of aging. A nail that is polished right down to the base prevents its live tissue from breathing, which is not conducive for a healthy nail. Nail polish should not be used all the time. Therefore, washing hands frequently is very important to avoid spreading germs. Many diseases such as diarrhea, typhoid, etc. are caused due to germs present on dirty nails. One should ensure that their hands are clean, especially before eating any food. Everyone must wash hands thoroughly after going to the toilet and before having meal. Therefore, hands should be washed after using toilet, handling raw food, that is before and after, touching the hair, face or body, sneezing or coughing, smoking, eating or drinking, handling chemicals, taking out garbages or trash, clearing tables, touching clothing or aprons, touching unsanitized equipment and work surfaces. Now we have bathing. Bathing cleanses and removes wax from the skin, stimulates circulation and provides passive and active exercise. Regular bathing is important for cleanliness and good personal appearance. They also prevent hygiene-related diseases such as scabies, ringworm, trachoma, and conjunctivitis. Bathing with soap is an important means of preventing the transmission of trachoma, that is, an illness that can cause blindness and other eye-sightness problems. Ideally, programs that promote bathing should be combined with a program to reduce the number of flies which spread trachoma and other diseases and to improve sanitation. For people to bath thoroughly, they must use sufficient water, but it may be difficult to promote the use of more water for washing if water supplies are distant and water must be collected by hand. Moreover, many traditional bathing practices do not use water efficiently and ensuring cleanliness may be difficult. By modifying existing practices, such as by encouraging the use of water containers with taps, it may be possible to improve the efficiency of water use. After this, we have clothing. Clothing is a feature of nearly all human societies. The amount and the type of cloth worn is dependent on physical stature, gender, as well as social and geographic condition. Clothing provides protection from sunburn in warm weather and protection from frostbite in cold weather. Clothes also reduce risks during activities such as work or sports. Some clothing protect from specific environmental hazards such as insect, noxious chemicals, weather, weapons, and contact with abrasive substances. Clothing can be used to indicate social status and convey individual, occupational, and sexual differentiation. Now we have importance of clothing. Clothing is important because it reflects an individual's culture, personality, and preferences. People can use clothing to enhance personal appearance and protect the body from extreme temperature and elements in various climates. The clothes says something about an individual and reflect one's personality in the best way possible. But it should also be appropriate for the weather, the occasion, and in good shape. The main objectives of wearing clothes are: number A, to protect the body against wind, cold, heat, rain, and snow. Number B, to maintain the body temperature. And number C, to cover the body and enhance one's appearance. The material most commonly used for making clothes are wool, cotton, linen, silk, artificial silk, and leather. Synthetic yarns are a comparatively recent introduction to clothing. It is important to understand that the nature and qualities of the different fabrics used to make clothing in order to make an intelligent choice from the point of view of utility, comfort, maintenance, as well as expenditure. A little understanding of the nature of different fabrics will help us to combine protection, comfort, and beauty in selecting our clothing. Clean and fresh underclothes are also of the utmost importance, much more so than clean outer clothes, because they are close to the skin and can cause bad odors and even infections. It is very important to change underwear like underpants, vests, rasaries, and petticoats every day throughout the year. In the summer, if we perspire a lot, we might need to change twice a day. It is much less unhygienic to wear a used t-shirt, kurta, or saris than it is to wear unwashed underwear after a bath. It is a good practice to get into clean and loose garment for sleeping at night. Night garments should be loose enough to allow free movement of the body. Now conclusion. Care of skin, mouth, nail are equally important and plays a vital role in the daily personal hygiene of an individual. Maintaining a good personal hygiene will help us in protecting from various diseases and infections. Not only this, good personal hygiene will help us in leading a healthy lifestyle and at the same time boost up our level of confidence. Thank you.